This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark Neuse.
Well, good morning, and thanks for joining us today on Columbus Concerns. Governor DeWine says Ohio is in some trouble right now when it comes to coronavirus. The cases are now hitting record levels once again. Let's bring you the remarks of Governor DeWine on Friday.
In just a few minutes, we will be discussing our new numbers for today, as well as what our color-coded map looks like this week. Sadly, our situation continues in Ohio to worsen. For my fellow Ohioans who have felt that until now this virus really did not impact their life, did not impact their family, and who have said, I'll pay attention when it gets serious. I'll pay attention when it threatens me and my family. The message to them today is, it is now serious. And it's time for all of us to come together. Truly, we need you. We need each and every one of you. We need you to be fully engaged in this battle. When, in a few minutes, you see the data, when you see how fast the virus is spreading across Ohio, when you see that the virus has spread and penetrated into virtually every county, extensively in every county, I think it will become clear that we all must together fight back. We all must be engaged. Today's Wall Street Journal, former New Jersey Governor Chris Christie has written a very powerful op-ed piece on his personal experience with COVID. Governor Christie, in his characteristic way of speaking bluntly and straight to the American people, said that he'd been wearing his mask for 7 months and then he didn't. He was diagnosed with COVID-19, spent a week in the ICU fighting the disease. He's with us today to tell his story. And so, Governor, thank you very, very much for joining us. I underline one part of your op-ed. I just thought it was so strong. And I'll just read it before I turn it over to you. This is your words, talking about wearing a mask, keeping a distance. These minor inconveniences can save your life, your neighbor's life, and the economy. Seldom has so little been asked for so much benefit. Governor, you're looking good. Thank you for joining us.
Governor, thank you for having me with you this morning or this afternoon, rather. And let me first just commend you for the job that you're doing in Ohio. You have been a consistent, strong voice right since the beginning of this pandemic, and I'm happy to be a part of your presser today. Listen, I think the easiest way to start this is to say, I thought I was safe, and I was wrong. I got tested every day when I walked into the grounds of the White House for the 4 days that I was doing debate prep with President Trump. I was assured, sitting in the third row of the Amy Coney Barrett ceremony, which happened after our first session of debate prep, that everyone in the first 3 rows had been tested that day and tested negative. I was assured that everybody in debate prep had been tested. And so I took my mask off. When I got to the gates of the White House, I had my mask on. When I walked through the gates and found out that I had tested negative at the White House medical unit, I took my mask off and I left it off, but only for the time that I was inside those gates. As soon as I left to walk back to my hotel, I put my mask back on immediately, kept it on when I was in the hotel lobby, walking down the streets. I only took it off once I got back in my room by myself. I did that for 4 days out of 7 months that we've been going through this pandemic. And 3 days later, I began to feel what I call the freight train of symptoms that happened with COVID-19. fever, headaches, incredible body aches, chills, sweats, and it overcame me in a period of 24 hours to where I'd gone from feeling fine and doing my work on a Friday afternoon to by Saturday at 1 o'clock being admitted to the hospital and taken immediately to the intensive care unit, where I stayed for the next 6.5 days. And during that period of time, I will tell you, it is a frightening experience. I want everybody out there who's listening to understand that this is one of the most unpredictable, random, and brutal viruses you'll ever see. And every day my doctors would come in and tell me, well, things are looking a little bit better or a little bit worse, but we can't guarantee you that within an hour it won't turn significantly worse. And with my history as an asthmatic since I was 13 years old, they were very concerned about how this would go for me. So my message to the people of Ohio and to the people of this country, which is why I did the op-ed, is that there's no place to hide from this virus if you're not going to take this common sense steps that the CDC and the NIH have recommended to us. Wear a mask when you're outside, remain socially distanced from people, no big crowds, and wash your hands frequently. I came out of this okay, and I'm very fortunate. I still feel some of the symptoms, fatigue most particularly, and my doctors say it could last for quite some time. But I survived. I'm alive, and it very well could have gone the other way. And for 220,000 other Americans, it has. So I just want to urge as many people as I can, don't let your guard down. It's not worth it. I went through it. I made a huge mistake by taking that mask off, and it's something that I hope no other Americans have to go through.
Well, thank you so much for not only being on our presser today, but, for just speaking out, for writing the op-ed, for sharing your experience. As you told the story to me before we went on the air, now as you tell it again, the psychological impact of a doctor telling you that must have been just terrifying. I mean, when they come in every day and say, yeah, you're doing maybe okay, or, but this thing could turn like that. Governor, I can't imagine that,
It was, and the thing that adds to it is you're in isolation. I was in the intensive care unit, but in isolation behind 2-inch thick glass. The glass was so thick that you couldn't hear the nurses on the other side of the glass. They would hold up a whiteboard, either giving me instructions or asking me questions, and I had a whiteboard to write back to them. And when they came in, they were in heavy PPE. And so you're just left alone with your thoughts. And, that's one of the things that I think people don't understand about this disease, because it's so random, because so little is understood, that, when you're there and you're going through it, the psychological effect that it has on you, and it certainly had on me, was significant. You start to think about, life and death, and you're in the throes of, at the same time, the way I described it to one of my friends was, it's like getting beaten up from the inside out. And that combination of physical and psychological stress is unique in my life and pretty extraordinary. So I can't emphasize enough. I know how tired everybody is of this. I know it. I felt it myself. But I will tell you that as tired as you are of strapping that mask on or going to the sink and washing those hands again, I can tell you, you will take those days in a heartbeat compared to getting this disease.
Well, and as you describe it, being basically in total isolation during this time, no family, no ability to, have somebody love there with you or hold your hand or do anything. It just must have been, it must be very tough. Thank you.
Governor, thank you for giving me the chance to talk to the people of Ohio today and to be a part of your team. I support what you're doing out there. I want to tell the people of Ohio that, from my experience, what the governor's advising you to do is exactly the right thing to do. And I hope that you follow his advice and direction. He has learned a great deal about this over the last 7 months, and he's been an incredibly articulate spokesman for the people of Ohio and for what we need to do to battle this pandemic. So you're all in my prayers. And Governor, thank you for giving me the time to be with you today and to continue to spread this message.
Well, Governor, thank you for doing it. Thank you for having the courage to describe what happened to you and your experience. And, I think that getting that story out, we'll never know, but I'm sure it will save lives. It will save other people from some real agony and their families from going through that as well. So you're looking great. You're feeling pretty good. A little tired, but you look good.
Thank you,
Governor. Thank you.
Well, thank you, Governor. I sure hope it does save some lives, both in Ohio and around the country. And God bless you for what you're doing.
Thank you. God bless you too. Thank you very much. Thanks, Governor. Today I'm wearing a purple tie in recognition of Purple Thursday. October is Domestic Violence Awareness Month, and Americans all over the country are wearing purple today to bring attention to this very important issue. Particular purple tie that I have on is Spring Hill College, which is where our youngest daughter, Anna, went. It was the purple tie I picked out today. If you need help in regard to domestic violence, if you need help leaving and getting to a safe place, please reach out to the Ohio Domestic Violence Network. Their number is 800-934-9840. That's 800-934-9840. That's the Ohio Domestic Violence Network. You can also visit odvn.org. And, of course, if you experience an emergency, you can call 911. Eric, let's go to the data. Well, as you can see, the numbers continue to go up. Today we're reporting 2,425 new cases since yesterday. This is the highest number we've ever reported on a single day since this started in Ohio 7.5 months ago. The highest before that was yesterday. Of the 10 highest days of new cases reported, 8 have occurred in the past 9 days. 9 have occurred in the month of October alone. And quite candidly, what is most scary about this is that it does not seem like we're even starting to get to a plateau. It just goes up and up. We have 12 deaths reported since yesterday. In addition, there were 159 new hospital admissions, the third highest we have reported so far, and 25 new ICU admissions. Today, we have an alarming number of counties that are red. 38 of our counties are red. We also have 3 counties that are now on the watch list, which means that they're between red and purple. That's Clark County, Cuyahoga County, and Hamilton County. This is an increase from 29 red counties last week. And 3, as I said, 3 on the watch alert. Watch alert simply means that all the indicators would indicate they're purple this week, but we don't post them as purple until they've done it for 2 weeks straight. So we don't know if they're going to turn to purple or not. We'll have to see what happens between now and next week, and then look at next week's numbers. The new red counties are Allen, Crawford, Geauga, Hardin, Lake, Lorain, Ottawa, Tuscarawas, and Wayne. 5 of these counties are red for the first time: Crawford, Geauga, Lake, Ottawa, and Tuscarawas. This is we've continued to show this, and here we are this week. This is the percentage of our population that is red. And then you see down here some in the orange, and then very, very small cases now, a few cases that are actually in the yellow. This means that the virus is spreading throughout all the regions of the state. It's penetrating everywhere. We now only have 4 counties that are yellow. This is the highest number of red counties, the lowest number of yellow counties to date. This means that 74% of Ohioans are living in a red county, 74%. Only 1% are living in a yellow county. Now let's go back. Let's show the alert map. Here again, 92.8, almost 93% of Ohioans are living in a county that is red or a high incidence county. I mentioned before that every week that I have a call with local health commissioners, and we did this past Monday. And every day members of my team are reaching out to these health commissioners as well. What we're hearing from these officials from all over the state is, of course, what we know, that Ohioans are tired. They're laying their guard down. They want to see friends and family. Let me share a quick example of what we learned about from the local health department that illustrates why we just don't have the luxury of letting our guard down. During the summer, as it got increasingly hot, a factory allowed its workers to remove face coverings. Unfortunately, the employees did not start wearing masks again when it cooled off this fall. Now there's an outbreak of 25 employees that crosses 2 counties with at least 2 hospitalizations so far. These stories continue throughout the state. And again, it is when we let our guard down. Chris Christie's story is really speaks volumes about what can happen. You can be very, very careful. You let your guard down for a relatively short period of time, and then boom, there it is. I want to talk about our watch list counties, and the first one will be Clark County. Clark is at a very high incidence, 251 cases per 100,000. What you're seeing in these watch counties is sustained increase in outpatient visits for COVID-like illness, sustained increase in hospitalizations, sustained increase in emergency department visits. So several of these are very early indicators, and they have to do with what's going on in the hospitals. Clark County is on the watch list for the first time since the alert system started 4 months ago. The county also exceeds the CDC's threshold for high incidence. Local health department officials report that there are 30 people hospitalized for COVID. They also report that they have a number of cases from long-term care facilities, but that much of the spread in the community is coming from people getting together with friends, just laying their guard down. We're seeing transmission throughout the county. Let's go to Hamilton County. Hamilton County is about the same level of cases. They're at the rate of 234 cases per 100,000 residents. They returned to the watch list this week. The county exceeds the CDC's threshold for high incidence. They're seeing growth in new cases and growth in hospital admissions. Local health department officials have told us that they had more new cases reported during the past weekend than any other weekend throughout the pandemic. And they're reporting their highest number of cases and hospitalizations than they've had at any point during the entire pandemic. Social gatherings, family get-togethers continue to drive community spread in Hamilton County. Let's go up north to Cuyahoga County. Cuyahoga County is a lower level. They are just right at the level about they're at 101 cases per 100,000, but they're on the watch list because of sustained increase in outpatient visits, sustained increase in hospitalizations, sustained increase in emergency department visits.
And Governor DeWine talking about the latest COVID numbers, along with a warning from Chris Christie, the former governor of New Jersey, who just got out of the hospital from coronavirus. I'm Mark News. Thanks so much for joining us today on Columbus Concerns.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.